We begin with a nationwide shortage that has parents doing whatever is necessary to find formula to feed their babies.
That's right. CBS News correspondent Christina Ruffini is at the White House with more on what lawmakers are doing to try and increase supply.
Erica Lopez has been scrambling to find formula for her 9-month-old daughter, Eliana.
I can't be doing this. I can't be running to 10 different stores every single month trying to find her formula. What else can I do?
But supplies are running out across the country, with 43% less formula on store shelves. It was 31% last month.
Moms on Facebook all over are like, well, does anybody know where I can find this formula or this formula or, and it's scary because how are you going to feed them?
Abbott says its plant, which was shut down because of concerns about tainted formula, could be restarting production soon, but it might take up to 2 months for that supply to make it onto store shelves. The White House says President Biden is considering invoking the Defense Production Act to increase supplies. Thursday, he spoke with baby formula manufacturers to try to get them to step it up on their own.
What we're doing here at this point in time is working with other manufacturers who can produce safe baby formula.
Biden administration officials say they're going to cut some packaging regulations to help get new products on the shelves faster. They're also calling for crackdowns on price gouging and working on importing more formula from overseas. But critics say the president has reacted too slowly.
House Republicans are here to push for action from the FDA and the Biden administration, who should have had a plan for this shortage months ago.
The House Oversight Committee has launched an investigation looking into supply issues and prices. The committee sent out these letters yesterday to manufacturers requesting documents. Christina Ruffini, CBS News, the White House.
And Dr. Christopher Duggan joins us now. He's the director of the Center for Nutrition at the Boston Children's Hospital. He's also a senior physician at the Gastroenterology, Hepatology, and Nutrition Department. Dr. Duggan, thank you so much for joining us. So we did hear from Christina's package there how frustrated a lot of mothers are, but give us a sense of exactly how bad this shortage is and the impacts that you're seeing.
Sure. Well, the shortage, as you know, was related to supply chain issues that actually predated the shutdown of the factory in Michigan. So this has been percolating actually for several months now. But the recall really pushed us over the edge in terms of formula supplies for children who with healthy gastrointestinal tracts who can largely take any different intact cow's milk or protein-based formulas versus those children with severe food allergies or severe GI diseases who are really stuck by this.
Some parents are struggling out there, even resorting to rationing or watering down this formula that they're so desperate for with whatever they have left in their storerooms. You advise against that. Why?
Well, I and the American Academy of Pediatrics and most physicians groups really strongly recommend against diluting formulas. When you think about it, infants are totally dependent on these formulas to meet their energy, protein, fat, micronutrient needs. So if you dilute the formula, you're not allowing them to grow well, for their brains to develop well, and they can suffer serious, significant problems from diluted formulas. So it's not a great idea.
And yet, a lot of parents find themselves not able to get the formula that they need. And they also find that there's a specific brand of formula that works for their baby and they want to stick with that one. So what advice do you have for parents who are not able to get their hands on the formula they like for their children?
Sure. No, that's a really important question. I do feel badly for these people. But as with any important medical or nutritional advice, evaluating those concerns with parents, pediatricians, and or their registered dietitians to make sure that any substitution they make is indicated for their child's nutritional needs. It turns out that, as you know, the infant formula companies make a wide variety of marketing claims that really make families worry about whether the formulas are comparable to each other. And anyone just reading the list of ingredients can be easily intimidated to make sure they know what's in their baby's formula. So seeking professional advice is really important here.
Dr. Duggan, I'm just curious for women about to have their babies, how much should be pushed for them to breastfeed?
Well, as you know, our country does a really poor job of supporting breastfeeding families compared to other countries throughout the world. In 2017, about 85% of infants were started to breastfed, and by 6 months of age, only 25% of them in our country were exclusively breastfed. So our country needs to take this example as a way in which regulations and policies should be done to encourage longer maternal leaves, paternal leaves, to encourage nursing mothers mothers to do everything they can to provide what we all know is the best nutrition for their infant.
Yes, Dr. Christopher Duggan, we thank you. Good information.
Thank you.